Okay, Kathy, follow me this way.
Sorry, can I just get you to help me take off my jacket, please?
Yes, you may.
Thank you.
Yeah. Okay, Kathy, we're going to go through a quick health history. So I'm going to give this to you to follow along.
Okay.
Have you ever received massage therapy before?
No.
No? And have you been referred here by your primary physician?
No.
What is your primary concern today?
My right shoulder.
Okay.
Something's going on in here. It's really, really sore, and I'm like, you had to help me take my coat off.
Right. Have you had any recent injuries to the area that is causing you discomfort?
No.
What's your occupation?
I'm a teacher, elementary school teacher.
You're a teacher, okay. So does this condition going on with your shoulder affect your occupation?
Writing on the board and trying to point to certain things
Okay.
definitely irritates it.
That kind of affects your activities of daily living in that you can't really go throughout your day as you normally would due to the shoulder condition that you're experiencing.
Correct.
How does this affect your sleeping, if at all?
It does affect my sleeping a little bit.
Okay.
I wake up a little bit throughout the night.
Okay. How often would you say that you are waking up throughout the night?
I'd say at least once or twice.
What position do you normally sleep in?
On my right side.
Are you normally very active?
I play volleyball.
Okay. So like you'd say you're like kind of like moderately active or...
Yeah, I'd say I'm pretty high.
Great. And do you have any other hobbies or things that you participate in?
I walk the dog.
Okay.
So sometimes that hurt trying to hold the leash and pulling me.
Mm-hmm.
I can feel it right in the joint.
Kind of like that, just like jerking motion?
Yes.
Okay. So it does affect some of your activities of daily living. So you already told me that the location of your pain is in your shoulder. How would you describe your pain?
I would say it's very, it feels very deep and localized. Like I can pinpoint exactly where it hurts. And sometimes it feels inflamed after doing certain activities or the way I sleep.
How frequent do you experience this pain?
Every day.
Okay, every day. And typically, how long does it last for?
A few hours at a time, depending on what I'm doing. If I'm writing on the board for a long time, it gets very irritated. Sleeping.
Okay, so writing on the board kind of like makes your pain worse.
Correct.
Okay. Is there anything that relieves your pain?
Sometimes ice pack.
Okay.
Just because it feels hot sometimes even when I touch it.
Are you taking any medications to help you with the pain?
No.
When did you really start to experience your pain?
I would say about 3 weeks ago, but I kept holding off going to the doctor.
If you had to quantify the level of pain you're experiencing, 0 being no pain at all, and then 10 being the most excruciating pain you've ever felt, where would you rate your pain?
I would say it's about an 8 out of 10.
Okay.
It's pretty high up there, but I can still manage it throughout the day.
Is that pain kind of referring, or do you feel it anywhere else in your body other than your shoulder?
Yeah, just like my shoulder blade a little bit, but...
Okay. So it kind of goes backwards into like
Yeah.
your back area, or... Okay. So next I'd like to determine some of your functional outcomes. So I'll be giving you the upper extremity functional index. And basically I'm interested in knowing whether you're having difficulty at all with the activities you'll see listed on this paper. I'm going to give this to you here, and you can just circle which one you believe applies to you for each of the activities.
Okay.
I'm going to quickly take your blood pressure. So what this involves is placing a cuff over your left arm, applying some pressure, and listening to hear for your blood pressure. Then I'll provide you with a reading. Is that okay with you?
Yep.
Perfect. So have you rest your left arm on the pillow here. Great, and I got a reading of 115/75, which is normal. I'm going to move into the assessment portion of the treatment. So the nature of my assessment will be to perform some tests to see what's going on with your shoulder. I didn't see any cautions or contraindications that would indicate for me not to proceed with the assessment. Some of the benefits of performing the assessment is that it'll guide my treatment and kind of let me know what techniques I should apply to improve your condition.
Mm-hmm.
Some of the risks involved in not participating in the massage would be that your condition would not likely to be improved, if at all. Some of the consequences, or I guess risks as well of participating in the massage, is you could feel slightly sore a few days following the treatment. With all that said, you certainly have the power to modify the assessment at any point in time if it's causing you any discomfort. I'll also be checking in periodically to ensure that I'm not putting you in any excruciating amount of pain or anything like that. Some alternatives would be a substitute decision maker if needed, or your doctor or healthcare practitioner kind of guiding the assessment as well. Do you have any questions about any of the above?
Nope.
And do I have your consent to assess?
Yes.
Okay, I'm going to be testing the unaffected side first, ruling out your elbow and your neck to ensure that those joints aren't causing you any pain. So what I'll have you do is flex your forearm, so bring it towards your body. Any pain or discomfort there?
Nope.
Okay, back into neutral. Now I'll have you pronate, so hand towards the ground. And any pain or discomfort there?
Nope.
Great. Now moving to your neck, I'll have you bring your chin to your chest. Flexion of your neck. Any pain or discomfort there?
No, just a little tightness I can feel in my shoulder pulling.
Okay, but no pain in your neck at all?
No.
Great. Okay, so then we'll have you rotate your neck, so bring your head towards the left side. That. Any pain or discomfort?
Again, tightness I can feel.
Okay. Okay. So we're going to move over to the affected side. Let me know if it becomes too uncomfortable or if you're feeling pain at all, okay? So again, we'll start with flexion of your elbow. So you'll just bring it towards your body like this. Pain or discomfort?
Nope.
No. And just pronate, so hand towards the ground. No pain or discomfort there at all? Okay. And now we'll have you rotate the other way, so towards your right hand side. Pain or discomfort there?
Again, tightness and irritation I can
Okay.
feel.
In your shoulder?
Yeah.
Okay. So I'm going to be testing the unaffected shoulder. So if you could please stand. The first range of motion will be abduction. So bring your arm up like this. Pain or discomfort?
Nope.
Okay, I'm going to apply some overpressure up again like this. Feel okay there? And now back towards your body like this with abduction. I'm going to apply some overpressure here. Pain or discomfort?
Nope.
Okay. Next range of motion will be a horizontal adduction. So bring your arm across your body like that. I'm going to apply some overpressure. Pain or discomfort?
Nope.
Okay. And now away from your body. Again with overpressure. Pain or discomfort? Nope. Okay. From here, you can actually move into external rotation. Pain or discomfort there?
Nope.
And how about with overpressure?
Nope.
And now down towards internal rotation. Apply some overpressure. Are you okay there?
Mm-hmm.
Okay. Now we're going to do shoulder flexion. So bring your arm up. And I'm going to apply some overpressure. And lastly, we'll move into shoulder extension. So reach back like this. And I'm going to apply overpressure here. Pain or discomfort?
No.
No. Perfect. Now I'm going to be assessing the affected shoulder. If at any point in time you're feeling pain or discomfort, just let me know. Okay, so the first range of motion, abduction, so up like this.
Yeah, that hurts. I can't go any further. That's really painful.
Okay, from there towards your body, how is that?
No, it's okay.
Okay. Next we could do horizontal abduction, so towards your body like that. Pain or discomfort?
No, not too bad.
And away from your body.
Just uncomfortable, but I can do it.
Okay. From there, actually we can move into external rotation.
Yeah, that hurts.
It hurts? Okay. And towards internal rotation.
Yep, same, that hurts really bad.
So from there we're going to move into flexion like this. Pain or discomfort.
No, it's not too bad.
And then extension, so like this.
It's uncomfortable, but I can perform it.
Okay. Okay, so now I'm going to take you through assisted range of motion of the shoulder on the affected side. So again, let me know if you're feeling any pain or discomfort. So I'm going to take you midway through abduction, and I know you were limited there before, so I'll take you here. I'm going to apply some pressure down, meet my resistance, build for 5, 4, 3.
Yeah, I can't hold that contraction.
Okay, and so we'll ask you to bring your arm towards your body again. I'll resist here. Build for 5, 4, 3, 2, 1. You okay there?
Yep.
Okay, and I'll bring you midway through horizontal adduction. So I'll resist here and build for 5, 4, 3, 2. Okay there?
Mm-hmm.
And I'll stand on this side. And then you'll push against the resistance this way. You're okay there? Okay. Okay, now I'll take you through external rotation. So bring your arm up like this and halfway through like this. And meet my resistance. 5, 4.
Yeah, I can't.
Okay. And then we'll go to internal rotation. So again, push down, meet your resistance. 5, 4.
Yeah, I can't again. Sorry.
That's okay. And next we'll go through shoulder flexion. So guys, here, we'll go here. And I'm going to ask you to try to bring your arm up towards the ceiling. Okay. Build for 5, 4, 3, 2. You okay there?
Yep.
Okay. And last one is shoulder extension. So you're going to try to push your arm back and meet my resistance. 1, 2. You okay there?
Yep.
Okay. Okay, so based on the different ranges of motion that we've gone through, I've noticed that you are especially limited in external rotation, this motion, also abduction, as well as internal rotation. However, I only noticed that when you were actually doing it actively, so on your own, but also when I took you through those motions as well.
Okay.
I also noticed that you actually have weakness during those 3 ranges of motion as well, which was about a 3 out of 5, which means that you couldn't hold that contraction for a certain period of time before you had to just kind of give out.
Okay.
So the next part of the assessment would be actually using a goniometer to measure the angles in which you can perform those different ranges, and then I can get a better idea of I guess kind of confirm my hypothesis, which is that there might be an inert structure that has the problem within your shoulder, okay?
Okay.
Okay, so I'm just going to place the goniometer just right here, and you'll perform abduction, so away from your body, like that. Okay, I got 15 degrees there. Because you're limited like that, we'll do internal and external rotation just across the body.
Okay.
So, have your arm up like that, great, and then you can just bring it towards your body. Perfect. Got about 45 degrees and away. And about 30 degrees there. We're now going to be performing some special tests. So the first test we'll be performing is the belly compression test, which tests the strength of subscapularis. So what I'll have you do is place your left hand on your shoulder, and your right hand will just be over your belly like that. What I'm going to have you do in a second is apply some pressure as much as you can to your abdomen. As you do, bring your elbow forward like this, okay? So I'm going to place my hand just under yours so I can feel the pressure you're applying, and then you can go ahead. Okay, and that would be a positive test because as you move your elbow forward, the pressure on your abdomen decreased, showing weakness in subscapularis. The next special test we're going to perform is Lippmann's test. The rationale behind performing this test is Greg Morling's research, which suggests that adhesive capsulitis is due to bicipital tendinosis. So we're just going to basically locate your bicipital groove and locate your biceps tendon. Bring your elbow into 90 degrees of flexion and just flick it under my fingers about 5 to 7 inches. Do you feel any pain at all?
No.
Okay, so that would be a negative test. The next special test we're going to perform is the empty can test. So I'm going to have you bring your arm out like this, and I'm going to come behind you here and just apply pressure downwards. Are you feeling any pain or discomfort?
No pain.
No pain? Okay. I know some slight weakness in your arm in that position, which would indicate a problem occurring with supraspinatus. Some of the observations I've noticed is you're sitting to one side holding your shoulder up to reduce spasm. I've also noticed that your affected arm doesn't swing when you walk. And there's a muscle tone imbalance between your upper and lower traps, causing imbalance of scapular stabilizers, as well as mild hyperkyphosis, so your shoulders are actually rolled in. And you have limited range of motion when you're trying to perform certain motions in external rotations like this, like taking off your coat. The first impairment would be increased fascial adhesions in pectoralis major, supraspinatus, and the GH capsule. The goal would be to decrease these fascial adhesions in these areas. The second impairment would be decreased range of motion in shoulder abduction, internal and external rotation. The goal would be to increase this range of motion by 25 degrees. Third impairment is increased resting muscle tension in the rotator cuff muscles, and we'd like to decrease this as one of the goals. The fourth impairment would be increased pain in the upper back and shoulder, which is about a 7 out of 10. And we'd like to decrease this pain in the upper back and shoulder to a 3 out of 10. The last impairment detected is a trigger point in supraspinatus with pain at about an 8 out of 10. The goal would be to decrease the pain associated with the trigger point to 3 out of 10. And ideally this would be done by December 15th, 2016. I move into the actual treatment, but prior to that I'd just like to go over a brief consent. So the nature of this treatment will be focused on your shoulder. So I'll be undraping the upper half of your body. Some of the cautions in treating your condition is the nerves and blood vessels in the axilla, as well as any lesions going on with the capsule. So I'll be positioning the pillows so that there's no tension on any of the surrounding muscles. Some of the benefits of the treatment would be increased range of motion to help you be able to perform the activities of daily living you haven't been able to perform recently, as well as decreasing your pain and fascial adhesions. Some of the risks of or complications of the treatment would be a little bit of soreness a couple days following the massage, but consequences of not having the treatment would be that your condition is not likely to improve at all. If anything, it could get worse over time. With all that said, though, throughout the massage, if you feel that you're uncomfortable, you'd like to change the positioning or stop the massage altogether, you certainly have the power to do so. And I'll also be checking in with you periodically to ensure that you're comfortable. Some alternatives would be if you feel that you're not having your goals met, you can seek another massage therapist. Otherwise, you can see a physiotherapist, a doctor, another healthcare practitioner. Do you have any questions about any of that?
No.
Perfect. So do I have your consent to treat?
Yep.
Great. So I'm just going to leave the room. What I'll have you do is adjust to your comfort level, but I will be working on your upper body, specifically your shoulder. So I'm going to give you a couple minutes to get between the sheet here, and then I will just give you warning before entering the room, and we'll proceed with the treatment, okay?
Okay.
Kathy, are you between the sheets?
Yep.
Can I come in?
Yep.
Okay, how's the positioning of the pillow by your feet?
Good.
Okay, just gonna add some towels. Just gonna place these towels underneath your shoulders to help with the tension in your upper back. There we go. Are you comfortable like that?
Yep.
I'm gonna begin with static contact. And I'm just gonna undrape your back to about here. Is that okay?
Yep.
I'm just going to be tucking in at the top here. That's okay as well?
Yep.
Just bring your arm out to the side. Can you relax here? Okay, so I'm just going to apply some oil to your back. Some quick effleurage. already feeling increased tone on your right hand side. Are you feeling any tenderness?
A little bit, yes.
Okay, I'm also feeling increased temperature. Might be due to some inflammation happening at your shoulder, specifically at the capsule. But the texture is pretty much the same throughout. Okay, so my first goal of treatment would be to reduce pain down to about a 2 out of 10. So to do that, we can apply some stroking, so some superficial reflex techniques. Just all over the back here. And on the unaffected side, we could apply some fun vibrations. And move over to the affected side. Okay, so the second goal of treatment would be to decrease the muscle tension occurring in the client's back. So to do that, we can again move into effleurage just to warm up the tissue. And then specifically to target the muscles we're working on, again starting with the unaffected side, move into muscle stripping. So apply a bit more oil. We're targeting supraspinatus. And also move into infraspinatus. Before moving on to the affected side, we could also apply some percussive techniques. So we could do some beating, some slapping, cupping. Okay, so now following the principles in massage, we're going to go for a more general technique. So broad contact compressions. We can move into specific kneading. Sorry. Okay, and to supraspinatus as well. And then just moving over to the affected side. We'll just repeat those techniques as well. So narrowing in on supraspinatus with some muscle stripping. Motion. Infraspinatus as well. Just really targeting the rotator cuff muscles. And some percussive techniques. And again, moving into broad contact compressions. And specific kneading. So moving into another one of our treatment goals. We wanted to really focus in on alleviating some of the pain associated with trigger points. Specifically, one was located in supraspinatus. So the first step would be to locate the top band, which I've located just here. We've already warmed up the tissue. So what we could do is apply specific compressions. We're looking for 2 out of 3 indications for a trigger point. One being local tenderness, another being a twitch response, and the third being an autonomic response. So I've seen the twitch response. The client has indicated local tenderness. So we'll apply some specific compressions until the client indicates that there is a decline in pain. Just hold that compression. How's your pain there?
Pretty good.
Okay. And then we follow that up with some stretch. Cross fiber and along with the fibers as well. And then just apply some heat. Okay, so moving into our next treatment goal, we're trying to do 2 things: maintain the range of motion that the client currently has, but also actually increase it. So what I'd have the client do is, first I take her through some passive ranges of motion, so extension of the shoulder. So this would be maintaining that range of motion. If I actually have the client actively do the same thing, so you can go ahead, within their pain tolerance of course, that would help to increase range of motion. Perfect. So another range of motion we could do that is limited is external rotation. Just bring my client's arm up passively and back down. And having the client repeat that range of motion actively. Perfect. I'm just going to grab your arm again. And we can also move into, just out of the way, some internal rotation. And have the client do that actively as well. Perfect. And you can just rest your arm along the side. Okay, so the next treatment goal would be to decrease the fascial adhesions that the client has in the around the rotator cuff. So I'm just going to remove the heat and grab a towel. So fascial work requires that we have no lotion, so I'd just be wiping this off. And with fascial techniques, we're working within the client's pain tolerance. So first I would be assessing the fascia. So basically just pulling in different directions to see where the fascial tissue is actually restricted. And once I've done that, I can indicate the direction to apply myofascial release. So I'd maintain this posture until I actually feel the fascia give. Go. Again, we could do it in this direction as well. technique would be direct fascial. So take up the slack here and just push the fascia apart. Even do some skin rolling of the upper back because the condition has caused the fascia to tighten up all around. And across. You okay there?
Mm-hmm.
Okay, I'm just going to remove these towels first, so you're better able to turn over. Okay, and I'm just going to pin here, grab all of the sheets from the other side. Okay, just bring your shoulder towards me. Okay. Okay, what I'm going to ask you to do is bring your right arm up towards the ceiling. Go. Just like this. And then I'm going to just put this down a little bit and clip. You can relax your arm. Bring your other arm up. And relax there. I'm going to ask you to bring your arm up again just so I can better access the rotator cuff muscles. Okay, just put me in here. And you can relax your arm back down. Now that we have access to the rotator cuff on the anterior side, we can assess the fascia in this area to see where restrictions might be. Just assess the fascia in all different directions. And again, moving into the myofascial release. Okay, and I just hold that position until I feel the release, also known as creep. And then apply in a different direction here. Another technique would be direct fascial. So this might be a little bit uncomfortable for the client. You okay there?
Mm-hmm.
And we can even do it in this direction. Another technique I could use would be frictions because according to Phil Page, frictions are effective for treating adhesive capsulitis since it promotes local inflammation and then allows for the realigning of collagen fibers. Okay, now that I'm done with the fascial techniques, it's important to flush out. And apply cold just to that specific area. So I left the cold pack on for about 10 minutes, which is sufficient time after applying a technique such as frictions. Finally, one of the rotator cuff muscles we haven't addressed yet would be subscapularis. So to access that, okay, just take a deep breath in. Okay, and let me know if your pain becomes too much. We could just apply some strumming there. Okay, so take another deep breath in, and then when you breathe out, I'm just going to apply more pressure in. Okay. Okay, and relax. I'm just going to move to the head of the table. Just so that I can apply some effleurage to the upper neck to relieve some of that tension that the client has from remaining in that posture for prolonged periods of time. So now that we completed the massage, I'm going to ask you to take a deep breath in. Breathe out through your nose. And one more time, take a deep breath in. And again, breathe out through your nose. Great. I'm going to leave the room. I'm going to give you a few minutes to get off the table. Make sure that you get off slowly to refrain from feeling dizziness or anything like that afterwards. And then I'm going to come back in for your reassessment, okay?
Okay.
How are you feeling? Good. Okay, so my clinical hypothesis is that you have adhesive capsulitis, which is inflammation and thickening of your joint capsule, causing the symptoms that you've come in today to be treated for. So I'm going to recommend to use some home care strategies that will improve your condition over time. So in addition to coming here bi-weekly to receive massage therapy treatment, I'd also recommend that you apply cold packs to your shoulder, 10 minutes on, 10 minutes off, making sure not to exceed that 10 minutes. Also go through those ranges of motion pain-free, so don't cause any pain or over excessive movement of just kind of like all of those motions that we've gone through before, like this. Mm-hmm. And also I'll show you another strategy that you can use. So if you stand up, please. Is you can get like a pole or a broomstick, and leading with your unaffected arm, you can just bring your arms out like this and then backwards the other direction. So you can go ahead and demonstrate that. So perfect. Just making sure that you are staying within that range where you're not causing any pain to yourself. You can have a seat again. A self-massage would be another technique that you could use just to maintain kind of that any relief of symptoms that you're having in between the massage therapy treatments, okay?
Okay.
Perfect. Well, then we'll see you in 2 weeks.
Thanks.